Okay, now we come to the last part, and this is the fun part. This is dealing with residents with difficult behaviors. Well, we don't have any of those, but I thought we would cover that. Let's list some examples of difficult behavior. Name a difficult behavior.
Somebody who constantly gets up out of bed and who shouldn't get up alone.
How would we handle that? How could we handle that?
Trying to redirect them and reason with them.
A lot of times, there's a trigger. They're getting out of bed for a reason. They're not just getting out of bed to make your life difficult. What are some triggers do you think might make...
Needing to go to the bathroom.
Yeah, being wet.
Being wet, they
Yeah.
don't like being in the bed.
Hearing loud noises.
Hearing a loud noise. They think they have to go find out what's happening. That's a good one. Okay, how can we what can we do to redirect them? Try to toilet them.
Yes, and see if that works.
And then if that doesn't work and they're still getting out of bed, what do you do?
Get them up. Get them in the chair.
Put them in a chair. Exactly. Try to occupy them. Sometimes they're hungry. You know, I've discovered that food goes a long way. It sure satisfies my soul. And I often will offer food over anything else. But you can't just offer it. You have to get it and hand it to them. You can't ask, are you hungry? Because they're not going to know they're hungry. Hand them something. Give them something to think about other than getting out of bed. What's another one?
Hitting.
Hitting. Okay.
Fighting. Kicking.
Yelling.
Yelling. Okay, what's a way to deal with that?
Politely.
Okay.
Walk away for a little bit.
Sometimes you
leave
have
them
to
alone.
step back and let them calm down.
Exactly. What if they're in the dining room and they all of a sudden you're trying to feed them and they start hitting and they start yelling, I don't want to be here, get me
Take
out of
them
here.
out of the dining room, definitely.
And where would you take them?
To their room.
Take them to a quiet place. A lot of times, what happens when somebody's acting out? What happens?
Everybody else acts out.
Yeah.
Everybody acts out, but what do the staff do? They all gather and try to help.
Yeah.
What's the one best thing you can do when somebody's acting out?
One-on-one.
One-on-one, exactly. Get them in a quiet place, take them to their room if it's quiet, if it's close, if you can get them there. If you can't, get them bring them in here, shut the door, sit down, and just let them calm down. Now I think of a lady in a jerry chair. She was in the day room this afternoon and her daughter was here with her. And one time, my office used to be back in the physical therapy department, and she sometimes goes into a fit. She's having a fit. She can't get out of the jerry chair. She can sure as heck knock everything out of you if you get close to her when she's in one of those moods. Believe it or not, she can. And here she's having one of those moods, and she's convinced somebody has stolen her $400 out of her purse. And she is not having any of it. Her kids are going to go without shoes. She's going to have to pull her kids out of school because they can't go to school without shoes. She's just absolutely crazy, and everybody's trying to calm her down, and the nurse is trying to give her her little calmer pill, and she's not having that either. She's spitting that everywhere. And so I said, everybody just leave. And I took the little jerry chair and I put it right by my office door, and I just went in my office and I started working. And pretty soon she's sitting there and nobody's in there. There was, I think, lunchtime. All the therapists were out for lunch. And she's just sitting there, and all of a sudden she got real quiet. And I said, are you doing okay? And she looked at me and she said, yeah. I said, how about some lunch? And she said, no, I don't think so. Not now. And then I think she talked more then than she does now. And pretty soon, what I had done was, while she was quiet and I was sitting there talking to her, I reached up under the blanket and I got her little purse, which was her trigger. Exactly, that was her trigger. And I just kindly put it behind me so she couldn't see it. And then we just started talking about her daughter coming to help her eat her lunch, and we got her out in the hall and we got her happy pill, and she had calmed down. But I mean, she was, if she could have climbed out of that jerry chair, she would have been out of it. She was so upset over that money. And she totally forgot it in a quiet place without anybody bothering her. And a lot of times that is what it takes. But can you go put them in the room and shut the door and leave them?
No.
Why not?
That's because they're not harm themselves.
Neglect, abuse. That's abuse. You cannot do that. So you need to put them in a safe place where you can watch them and let them calm down. And one-on-one. If everybody else will just clear out. What's another one? Yelling. That's a good one, because we've got 2 yellers right now, or maybe 3 or 4.
We got a building full of them at night.
Yeah.
At night.
Come night
okay.
time, yeah.
Come nighttime, they're all
Sundowners.
Sundowners.
Yeah. So, when you have a yeller, how do you handle it?
Well, you try to talk to them and calm them down.
Mm-hmm.
But most of the time, that's not what they're wanting.
Mm-hmm.
Like I have one that hollers for her mother, and her mother's not alive.
Mm-hmm. Do you tell her mother's not alive?
I don't have the heart to tell her.
No, you're not supposed to. Get into their imagination. Say, you know, oh, well, your mother's already gone to bed. We don't want to wake her up. She needs her sleep right now. You could say, your mother had to go tend to your dad, but she'll be back. She'll be back. Get into their, whatever it is that get into it. It's fun, really. Years ago, in the 60s or 70s, they had this thing called orientation therapy. And somebody'd tell you, I want to see my mother. Well, no, you can't because your mother died 10 years ago. That's what you're supposed to tell them. Well, that did a lot of good, right? And that really oriented them, right? For about a minute, maybe. So, let's say that you have someone yelling and screaming that they need to go home because their kids are going to get off the bus and nobody's going to be there to see them. How would you handle that?
Tell them that somebody's going to pick them up.
Mm-hmm.
Well, what do you do if you have one that's yelling to go to the bathroom and you know you just come out of there 3 minutes ago?
Mm.
And they've been changed and they've been toileted, but yet they're still consistent on going. What do you do then?
I guess let them yell. I don't know what else, because they don't realize for some reason the trigger is to go to the bathroom, and they're so worried. You have to remember, people this age were potty trained at 1 year old. I'm serious. People in their 80s and, well, no, I better not say that. I'm too close to that. 90s, maybe in the mid 80s and up. My mother said I was potty trained, so maybe 80. I was potty trained at 1 year old. No, I wasn't. My mother was.
Mm-hmm.
But these people have been so trained, they got whoopings if they messed up their clothes. Because clothes were hard to come by. They only had 1 or 2 sets of clothes. They might have a dozen diapers, they might not have a dozen diapers. Very poor families do. And a lot of these people are from those kinds of families, and they were strictly toilet trained. And as their mind goes back, they're so worried something's going to happen. And so they think they have to go to the bathroom all the time. Now that's my theory, but it may not be for everybody. But I know how people were trained back in their 80s now, how they were toilet trained 80 years ago, most of them, especially if they were country people.
It is sundowners in some part, but it mostly happens after her significant other leaves.
I know you're talking
And then that's when it really goes sour.
And then she has the rest of the patients yelling with her.
So
it's like you got backup.
but it's really, unless there's someone in there 24/7, it's not going to.
And when does their significant other, what time do they leave?
Usually
6
right after
or
supper.
About 6.
Mm-hmm.
I wonder does she get a sleep pill?
Oh, yeah.
Oh yeah, but it don't work.
She gets a lot of pills.
I wonder if we could talk to Dr.
They don't want to eat and they spit their food out.
Okay. What are some different things you can do? Maybe it's something they don't like.
Yeah, try it. Yeah.
Offer them something different.
Offer them something
And
different.
you can also finger foods. You can try that.
They might try to feed themselves. What about, I remember I had somebody that wouldn't eat, and I tried breakfast syrup, and it worked on everything.
Put sugar, packs of sugar in.
Not much, yeah. You don't need to use much, but just enough to sweeten it a bit.
Right.
And they, especially pureed. Pureed is
Oh
more.
yeah.
Okay, there's one other, and this is a big problem.
The showers.
I should have let Elaine go next.
Oh, I'm sorry.
I know, but they have more experience with that.
Sorry.
Showers, okay. What would be your approach to somebody that does not want adamant? I already had a shower last night.
Oh, man.
Which candidate would you like? Because I got the perfect one in mind.
Okay, how do you handle it?
I go to the nurse.
You go to the nurse, okay. And what does the nurse do?
Just talk and I don't know, just
try to talk them into it.
Well, I used
you
to
know
have-
how.
If you get in their world, don't tell them, don't go in the room and say, oh, now we're going to take a bath. It's bath time. Oh, this is so much fun. And they said, no, I had a bath last night. I'm not going to take a bath. Go in, get somebody else to get their clothes together. You get their clothes together, take them out. Don't let them see you. Just kind of get their clothes together and take them into the bathroom. Then go back and sit and talk to them and say, let's go for a walk. Let's go for, it works. You don't look that way. It works. It's worked for me. So you get them walking towards the shower and they get to the door. Oh, what's this? Oh, well, we're just going to go in here for a minute. And this is walking. These are walking people or in a wheelchair. What I would love to do is take each one of you, strip you, put you in a shower chair down here in John's room, cover you with a bath blanket, and push you down the hall and take you to the shower room. How would you feel?
Naked.
Exactly. And these little old ladies who don't like, their husbands never saw them with their clothes off. I promise you, ever.
Well, they got kids.
Most of them.
They get lights are out.
That's what I'm dealing with.
So, what you would do is you have to get in their world. Think about what they're interested in. Get them talking about fishing. Hey, have you been fishing lately? While you're doing that, don't put them in the shower chair in their room. I know it's easier for you, but it's going to be a heck of a lot easier to get in a shower chair in the shower room than it is and to push them down the hall. I cringe when I see somebody because I think if I ever have to go to a nursing home, I'm never going to take a shower if it has to be that way. I mean, it's just embarrassing to push them, even though you've got them all covered up. But
There's one
everybody
little
knows.
resident I do, but she's fully clothed. But I just take the shower chair down there
Mm-hmm.
Yeah, but the resident I'm thinking of,
with her fully
it takes
clothed
3
though,
people.
and roll her back with the shower chair
Mm-hmm.
instead of just
Right,
with the wheelchair. But she's still fully clothed,
right,
and even when I take her back, she's still fully clothed.
right. But it's
In the
still
shower chair.
it's still a shower chair.
Yeah.
And everybody knows they've had a shower, and everybody knows you're naked. It's just old thinking. It's just these people have, they never lived in a dorm. They never lived in an apartment with 3 other people running around in your bra and panties. They've never done this. They've never been where other people can see their bare skin. And it's embarrassing for them. So, any other thoughts on disturbing behaviors?
yeah, so if you push them in the shower in their chair and they're fully clothed and they still beat the snot out of you, how do you deal with that? Even though you're talking to them and telling them what you're doing, but it still takes 3 of you to get that person to cooperate, and they're still fighting you every step of the way.
But maybe you could get somebody who is, I don't want to use that word, quieter, but somebody that can approach them in a different way.
We've tried everything. We've tried the nurses, we've tried one CNA, it doesn't matter how you talk to them, you better duck or you're going to come up with a busted lip.
Is that the one that got the? Is
Yes,
that who you're
that's
talking about?
exactly what
Yeah,
I'm
because
talking
those
about.
2 were in there trying the other night, and I was trying to talk to him, and
And
they were
there's-
working on
it's-
him. I mean, really, they're right about that particular
Then we need
patient.
to get some Ativan or something.
Well, he had that too.
Yeah, it's just,
He gets that before.
But it's like, okay, up to that point he's fine, and afterwards he's pretty
yeah, it's
okay.
after the shower he's fine, but
He's
it's
fine.
during the shower.
There's
mean, it's
2 of
just
them
like
that's
a
like
light
that. There's a
switch.
male and a female that's like that.
Just like a light switch, once they're out, they're fine.
I mean, and sometimes they do real good. Sometimes just depending,
Mm-hmm.
and then there's other days where it's just they're not.
Well,
It's
it depends if
impossible.
it's a full moon or not. If it's a full moon,
It's a lunar
you're
effect.
still gonna get bit.
But then in that case, it's a full moon almost every night, every shower night.